Good afternoon. Thank you for listening again today. As of 2 p.m. today, there have been 1,327 positive cases of COVID-19 in Missouri, including 14 deaths. As I said yesterday, we are testing more and more people each day, so we will see these numbers go up. But we will continue doing everything we can to respond accordingly, support Missourians, and protect public health. We know there have been a lot of questions this week about the National Guard and alternative care facilities. The Guard has been working since last week and through the weekend as part of our efforts to identify potential alternative care sites, if needed, around the state. Along with the Guard, the agencies involved in these site surveys are DHSS, SEMA, the Office of Administration, the Missouri Hospital Association, the United States Army Corps of Engineers, FEMA, and the U.S. Department of Health and Human Services. Nothing has been confirmed at this time, but we have looked at several possible locations, including the Kemper Arena and the Independence Event Center in Kansas City, the Edward Jones Dome and the America Center in St. Louis, the Hammond Student Center and JQH Arena in Springfield, Missouri Southern, Leggett, and Platt Arena in Joplin, the Show Me Center in Cape Girardeau, the Hearns Arena in Columbia, and today they are in Kansas City, again assessing two possible sites. They are looking at three main selection criteria for these sites, including located in areas with the possibility of deficient bed counts, areas large enough for patient population, and areas where utilities are available to start immediate construction if necessary. This is just another example of how we are moving forward to put plans in place, anticipate needs, and support our communities during this fight against COVID-19. Today, Director Karsten is here to give an update on the National Guard and public safety. Director?
Thank you, Governor, and good afternoon, everyone. Thank you again for joining us. First, I want to thank all the members of our interagency group who've been scouting and planning for the alternate care sites. As Governor Parson described, this is a joint state and federal effort. They're working 24/7 as one team, traveling around the state so that Missouri is prepared. Their efforts are just another example of the unprecedented efforts we're bringing to the state's response to the coronavirus outbreak. Some people have begun to call this period the nation is going through the Great Adaptation, because we're all having to adapt and adjust to a new way of life. It's not easy, but it's what must be done. And the better we do our jobs now, the safer we'll be and the faster we'll get through this. I was at our Strategic National Stockpile warehouse a couple of hours ago. Just yesterday, the S&S team shipped more than 106,000 N95 respirator masks, and they also shipped out more than 17,000 surgical masks and 4,000 surgical gowns yesterday. Since this effort started, Missouri's S&S warehouse has shipped more than 6,700 cases of PPE to Missouri hospitals, healthcare centers, and EMS agencies. The warehouse team is just one part of DPS, and our other team members are also adapting to these unprecedented conditions. They're practicing social distancing, they're working from home when possible, but we're also having people work in different areas they've never worked in before. We have an earthquake safety expert who's now part of our SEMA procurement team. We have a newly hired member of SEMA's logistics team who just started her first day on the job yesterday. The HR process was expedited, and she's already making a difference. All of our DPS divisions and state departments are adapting to meet the challenges of the COVID-19 crisis. We need the public to continue adapting too. As many Americans have noticed, traffic is down on our highways, but our highway patrol troopers report that more motorists are speeding and driving distracted. Yesterday, 3 MoDOT attenuator trucks were hit in one day in the St. Louis area. We're asking motorists to slow down and concentrate on the job of driving. These are challenging times. They're impacting all of us. We ask that you adapt, not just by practicing social distancing and extra hand washing, but making good choices in everything you do, and we'll get through this together. Thank you.
Director, thank you very much. Thank you. I appreciate it. We continue to use all resources available as we adapt and respond to COVID-19 each day. Like all of our state departments, the Missouri Department of Corrections is taking all steps necessary to help combat COVID-19 and protect the health and safety of incarcerated individuals as well as correctional staff. DLC suspended visitor access at all state correctional facilities earlier this month. And I want to be clear, we have no intention of releasing incarcerated individuals at this time. We will continue to take the necessary steps to protect their health and safety within the correctional facilities. Today, Director Precythe is here to give an update on the Department of Corrections. Ann?
Thank you, Governor. I'd like to thank the Governor for inviting me to talk with the public today about what is really happening inside our institutions as it relates to COVID-19. We are no different from the community at large in the sense that our environment is changing daily as well. The information I'm about to share with you is as I know it right now at this moment. There are no positive cases of coronavirus in any of our prison facilities. One offender tested positive while hospitalized and has since tested negative twice, but remains hospitalized because of other medical conditions. 2 staff have tested positive, neither work in a prison. As of this morning, 18 offenders have been tested for the virus, 13 tested negative, 4 are pending, and 1 is the previous that tested positive that is now negative. Our preparation efforts have been focused on keeping the virus out of our institutions as well as a containment process if the virus gets in. So what are we doing? As the Governor mentioned, on March 12th, we suspended offender visitation. We have suspended offender transfers between prisons. We're screening all incoming offenders received from county facilities at intake. We have around-the-clock medical staff on site at all of our prison facilities. All staff, healthcare workers, and offenders have been educated on ways to stay healthy and to continue to receive information on the virus. Managing communicable diseases in prisons is not new. Every year, we prepare for the flu and are forced to contain and isolate those that are impacted to prevent the spread of the disease. However, we've modified some of our existing processes in response to COVID-19 to include identifying isolation cells, potentially a wing within a housing unit, even up to an entire housing unit if needed. Strict sanitation guidelines have been implemented at all of our locations, and we have ensured that there are ample cleaning supplies available at every prison location. Prisons, like hospitals, cannot operate without staff. And I want to take a moment to say thank you to all of our dedicated, hardworking corrections professionals, because it's times like these when they rise to the occasion. Though not often seen, or heard about, or thought about, we are crucial to public safety. So whether it's working inside a prison, supervising offenders in the community, or just providing support to the thousands of corrections professionals, the next time you see a corrections professional, a correctional officer, a probation parole officer, please let them know how valuable they are to what we do and say thank you. We would appreciate that. While our primary focus during this public health crisis is keeping our staff and our offenders safe, we're also excited to be able to share with how we're helping the larger community. Prison Industries, known as Missouri Vocational Enterprises, or MVE, operates 22 factories in 12 prisons across the state. Skilled DOC staff provide hands-on job training for offender workers who produce products and services for government agencies and nonprofit organizations. 3 of these industries have modified their operations to help during this crisis. Our chemical plant in Bonne Terre is producing hand sanitizer. MVE, in conjunction with several private donations, is making 6,800 gallons of alcohol-based hand sanitizer. Production began last week, and we are ready to begin distribution of both gallon and 4-ounce bottle quantities this week. Our factory in Cameron has ramped up production of toilet paper by 20%. Increasing hours of runtime by adding an additional shift has allowed us to manufacture approximately 3,500 cases of tissue each week. And the Veterans Commission reached out to us with the need for protective gowns. Our clothing plant in Jefferson City created a prototype, which has been approved, and we are in the process of making 4,000 gowns. In the Department of Corrections, we continue to be transparent with our staff, the media, and offender friends and family. You can visit our website on doc.mo.gov for additional information. Opportunities like these today, where the governor has provided an outlet for us to be able to communicate directly with you, are an excellent example of transparency. And I want to personally thank the governor for his exceptional leadership during this unprecedented time. It has modeled for me and for my staff that we will stay the course, we will continue to support him as he supports us, and together we will get through this. Thank you.
Thank you, Director, and thank you for the kind words. As I listened to you speaking, I thought to myself, there's somewhere under 30,000 people incarcerated in the state of Missouri, although definitely a different format whatsoever, but it does somewhat goes back to the point of, stay home when you can stay home. And you see when this facility is probably one of the safest ones in the country for the way we're conducting ourselves and people doing, quote, in that environment what they're told to do. But again, it goes to prove to all of us, staying home is a big issue, and it's something we always need to remember. It goes without saying that COVID-19 is having a serious impact, not only on public health, but also on the economy. The Department of Economic Development has been actively reaching out to business leaders across the state to see how they can assist during this challenging time. DED is also exploring other creative ways to contribute to our COVID-19 response, such as repurposing community development block grants. Last week, DED, SEMA, DHSS, and the Office of Administration partner with the Missouri Association of Councils of Government to purchase 125 ventilators with these funds. $2.8 million in funding will be used for the purchase and distribution of the ventilators. And Director Dixon is here today to give us an additional update from DED. Director?
Thank you, Governor. And I really want to say thanks to the thousands of Missouri businesses around the state who are stepping up to help our state and our citizens overcome the current situation and the crisis that we're facing. So many businesses have stepped up, and I wanted to highlight and thank just a few of them here today. Orscheln Farm and Home Supply Stores, headquartered in Moberly, have activated their supplier networks and relationships across the country to help us address the needed material and supply for this fight. A construction equipment supplier in Fenton, Missouri is now working with SEMA to procure N95 masks. 2 other supply companies, one in St. Louis, one in Kansas City, neither of them were working in medical supply before this, are now working with SEMA to help procure the equipment that we need. Trabon Group, a Kansas City printing company, is now producing face shields for hospitals in the Kansas City area. In addition to these employers, there are a number of breweries and distilleries that are now making hand sanitizer for healthcare workers, nursing homes, first responders, and nonprofits. And I'd like to highlight just a few of them as well. Of course, Anheuser-Busch in St. Louis, J. Rieger and Company in Kansas City, Four Hands Brewing in St. Louis, and Switchgrass Distillery in Wellston are all partnering together to help get needed material and supply across our state. The Missouri Economic Development Department is continuing to work with manufacturers and businesses to help produce and procure additional PPE and necessary medical supplies across the state. If you are a manufacturer or a business that would like to contribute to this effort, you can let us know by visiting our website at ded.mo.gov/howtohelp. That's ded.mo.gov/howtohelp, and you can find information on the needed materials and equipment to fight the COVID virus. As many of you have heard, and as folks have been watching all across the state over the last week, a federal stimulus package is going to provide necessary assistance to Missouri businesses and employers, especially that will help our economy overcome this difficult time. Many of these programs are still being implemented and developed by our federal agency partners, but we're going to continue to make sure that Missouri citizens and businesses have the latest information on them. I wanted to highlight just a couple of the benefits that are being discussed in Washington, D.C. right now that address small businesses in our state. There's a Paycheck Protection Loan Program for employers who maintain their payroll and workforce during the emergency. There's relief for businesses with additional funding for Small Business Administration loans. There's additional funding for economic development loans as well as economic injury grant programs, some of which do not need to be repaid depending on the situation. There's counseling and training programs available for small businesses to help you navigate these uncertain waters. And finally, there are a variety of tax credit as well as federal payment programs to help assist employers that have had to shut down due to the epidemic. Again, many of these programs are still being implemented in the federal legislation that was just passed. We will continue to make sure that our state's employers have the latest information as well as being standing by to partner with you any way that we can. We appreciate so much the private sector that's stepping up to help our state overcome this, and we will work through this together. Thank you.
Thank you, Director Dixon. Thank you. Another concern that has come to our attention is the overcrowding of state parks. Although we encourage outdoor activities to help cope with the stress of COVID-19, the health and safety of Missourians remain our first priority. We have been in conversation with the Department of Natural Resources, and they are working quickly to address this issue. Today, Director Comer is here to give us an update. Before Director Comer comes up here today to give her briefing remarks, I want to share with you about Director Comer. Director Comer has had quite a battle with cancer over the last several months, and I want to talk about one of the most strong-willed ladies that I've ever met to go through what she's went through. But today, here she is, ready for the call of duty again as a director to be able to help fight us, combat COVID-19, to be able to do what it is she does best. So I'm so proud of her. I'm proud of all my directors, but it's great to have Carol up here today to give us a briefing. Carol?
Thank you, Governor Parson. And some people call it strong-willed, other people call it stubborn. In response to COVID-19 pandemic and in according with CDC guidelines and the governor's executive orders, the Department of Natural Resources has modified operations at Missouri state parks to encourage appropriate physical distancing. In the past month, Missouri State Parks has canceled or rescheduled all tours and programs, canceled or rescheduled all third-party events, closed visitor centers and park offices, and finally, we closed our playgrounds and suspended camping and overnight lodging in all parks. Today, Missouri State Parks is further modifying our operations at 5 state parks and implementing operational changes at all state parks to address overcrowding and concerns regarding public safety. The operational modifications, including temporary closures of 4 state parks and partial closure of additional state park, will go into effect at 5 p.m. on Thursday evening, April 2nd, and are scheduled to continue until April 30th. These modifications include the closure of Castlewood State Park, the closure of Elephant Rock State Park, the closure of Watkins Woolen Mill, and Weston Bend State Park will close. Also, at St. Joe State Park, we will close the off-road vehicle riding area. Finally, at all state parks, gates to individual parking lots may close when the lot reaches capacity. If a park looks full, it probably is. While safety, stewardship, and service are all very important to Missouri State Parks, safety is our first priority. We will continue to evaluate and make adjustments as future concerns arise, And if you're planning to visit any state park, I encourage you to check out mostateparks.com for individual park advisories and updates and the latest actions that are taken in response to the COVID-19 pandemic. There are many state parks still available in your communities. We ask that you be respectful of all facilities, other guests, and the amazing staff that are still serving the public. Finally, when you're outside or inside, I can't express enough the importance of following the guidance provided by the CDC and Governor Parson. Keep 6 feet away, avoid crowded areas, wash your hands often, avoid touching your face, cover your mouth and nose with your elbow when you cough or sneeze, and most importantly, please stay home with your sick. Thank you.
Director, thank you very much. Look, the last thing we want to do is be shutting down outdoor facilities, state parks, and so forth. But again, it comes back to the personal responsibility of how we conduct ourselves and how we act. And those other parks will remain open. We'll keep them open, but people have to remember the ordinance in place. No more than 10 people together, 6 feet apart. And I think those are, if you just remember that, I think that's the most important thing we can do as a state, as individuals, to abide by that. Kelly, questions today?
Yes, I have several for you, Governor, and then I have a couple for Dr. Williams and one, I think, for Director Karsten. So first off, Governor, James Klein, he has 2 questions. Do you share the optimism of President Trump that the economy will rebound quickly post this pandemic?
Yeah, I do think the economy has a great opportunity to rebound very quickly. I think we're still some days away from that. But, you know, this is not like a normal recession. I think those jobs are going to be there when we get through this epidemic, when we get through this COVID-19 virus. Those jobs are going to be there. I think the economy is going to pick back up. I think that's the good news to it. And I think that could be in short order. But I also just have to focus right now on what are we going to do with the virus and what are we going to do in the next 30 to 60 days. And I think we're going to have a better outlook once we see that time go by.
Okay, another question from James. How have you reached out to leaders in ethnic communities across the state to understand their needs and respond with help and reassurance during this time?
I think every day our directors are in contact with people trying to figure out what their needs are, whether that be whichever community that might be, that we want to fulfill that. And there's outsourced resources we can do. Through the clergy are willing to help. The nonprofits are willing to help. The business community, the directors are well aware of that in those communities and how we're going to focus to help and rebuild that. You know, right now it's a struggle for all Missourians, especially in smaller communities that are bound together. It's a tough time for those small areas and has a huge impact on small businesses in those areas. But every day we're trying to find what resources we can to help in the long run for those small areas.
Okay, Governor, this is from Jacqueline Driscoll, St. Louis Public Radio. Lawmakers have said they're returning to the Capitol next week to work on the supplemental budget and the state budget. If you extend the social distancing order, will this keep the Capitol and other state buildings closed? And will you allow journalists in the Capitol?
Well, first of all, the other state buildings will be closed while the legislators are here. We're going to take every precaution available when those legislators come in there. You know, it's a big group, so we're going to try to maintain that distance, and we're going to figure out a solution, how we get them in the building. Maybe we don't have all of them in the building at the same time, but, you know, the legislators are working on that. There's a plan in place. And the public, as far as I know, the press would be allowed in the building, per se. I'm not sure what the end of that question means. Are we going to be having press conferences again like we did? The answer to that is probably no. Everybody's going to have to adapt to doing things differently. And I know the media would like to come back in and have the full press conferences, and there'll be a day for that. But right now we all have to make adjustments to that. And we're doing the best we can here with what opportunities we have and to be able to answer the questions that we have.
All right, Governor, this is from Curtis Hancock, ABC 17, Fox 22. Have you looked at models of the impact of a statewide stay-at-home as opposed to the no stay-at-home order?
Yeah, every day we look at the models, or quote the models that we look at every day. We look to see how many counties in the state of Missouri has a positive hit, how many of them are multiple hits, you know, and we go by that to make the decisions on what day, if we do a stay-at-home type of stay at some point, if that was the case. But right now, I'm not at the point to do that, but we look all over the counties. Right now, there's still 95 counties in this state that has less than 5 cases of the coronavirus in it. And the majority, 75 of them, has 1 or 2. So I have to take that all into consideration as I make decisions on how it affects, one, the economy, how it affects those areas. And I realize the coronavirus will spread and continue to spread, but those decisions will be made daily. And right now, I think the most important thing you can do, regardless of all the other orders out there, less than 10 people, 6 feet apart. And you've got to maintain that. If you don't need to be out, stay at home.
All right, thank you. Governor, this is from Bridget Lavelle from KY3. She's had several complaints that people are struggling to get through the state's unemployment website. They've said it's crashed, they can't get through the phone lines. Is there anything being done to help that?
Well, yes, we are. A lot of things we're doing. Just not too long ago, I was bragging because ours was still up when most of the other states have already crashed several days ago. But the idea is ours did go down for several hours. We put the email in process where you can get a hold of them by email. But look, there's just thousands upon thousands of people trying to reach that office every day, and we're doing everything we can to process those claims, and we'll continue to do that. We got people working around the clock over there. And again, these are just things that's never happened before, and we just got to work through them. But eventually we're going to get everybody worked through that system as soon as we can. They're working their tail ends off over there and trying to do everything they can to process.
All right, Governor. John O'Sullivan from KMOV. Workers from the Wainwright Building in downtown St. Louis have told News 4 that a worker tested positive for COVID-19. They believe the building, which houses several state offices, should be closed to workers. Can you tell them why it has not been closed?
Yeah, we adapt them just like everybody else has to do in Missouri. You know, we take that, we take the precautions it needs with that worker, we take to figure out how we get a safe environment out there. But we're not going to just necessarily shut down an entire state building because somebody tested positive. There's actions you can take for that. You can secure the floors, you can secure the space, but it's not time to shut down an entire state facility when we've had one positive COVID-19. We're all concerned about that, but there's steps we take, there's policy and procedure in place, and as long as we follow that, we're going to be okay.
Okay, and the last question for you, Governor, is from Chris King. He's asking you to respond. Auditor Galloway called for you to have a statewide stay-at-home order.
Here's what I would suggest right now. I would say the state auditor needs to worry about being the state auditor right now. All of us elected officials right now need to have one thing in mind is what do we do to help with the COVID-19 situation? This is not the time to play politics out of this issue and try to figure out who gets one up on it. There'll be plenty of time for that down the road, plenty of time. But today is not the time. And we need to focus, all of us statewide elected officials need to focus on your jobs and do what you personally can do to help the people with COVID-19.
Okay. The next couple are for Director Williams. Okay, Director Williams. The number of confirmed, this is from Jim Salter, from AP. The number of confirmed cases rose by 296 today, with similar percentages jumps over the past several days. Do you believe the increase is indicative of Missouri becoming a hot spot, or is it more indicative of high numbers of available test sites in the state?
Well, Jim, thanks for the question, and it really highlights two things. One is we have done 16,000 tests in Missouri. And if you look at the other 8 states, I think every young Missourian learns that we share the distinction with Tennessee of being contiguous to 8 states, the most in the country. And other than one state, we've done more testing, sometimes by a factor of twice, than all the other states around us. And that's been very purposeful. That didn't just happen. I can't say enough for the people at the Department of Health and Senior Services who've made that happen. Again, Bill Whitmore, who's president-elect of the American Public Health Laboratory Association. There's a very purposeful reason that we've been doing all that testing. And so, as the governor has said repeatedly, we will see more tests come back positive. That helps us very much define where the problem is. Fred Eccles, thank him so much in St. Louis, and Mayor Cruson. We're opening up 2 new sites with our help in northern St. Louis. I talked to Senator Carla May this morning. She was very concerned about that. And so we'll do more testing, and that will identify more positive people, which not only helps those people as individuals so that we can help them know they have the disease and get better, but also tells us where we need to concentrate our resources. Half our cases in Missouri are in 2 counties, and that trend is continuing. So we are very much focused on those 2 areas. So, Jim, I'd say the answer to your question is, yes, it's surely a reflection of more testing. We're doing as much as anybody. But also that we are seeing clusters in metropolitan areas, much as the rest of the country is seeing, and that's where we're very much focusing our attention.
All right, Dr. Williams. Jack Suntrup from the St. Louis Post-Dispatch. When does the state expect all reporting to be streamlined so that counties in the state are all reporting the same numbers at the same time?
Jack, thanks for the question. I know it's something you're very interested in. What we've done now is that all testing is mandated to come into the state. That's a change. It used to come into the local health departments. But we've got tests coming in from all the providers. They are mandated to report that within 24 hours, but they can come in anytime during that time. We've talked to our big labs, Quest, LabCorp. They tend to bunch them and report them early in the morning. And that's why we've gone with a 2 o'clock reporting time so that as we try to be transparent, something other states and counties have been criticized for, but we try to get the information out in a very uniform way so that both our media and others in policy making decisions will know that there's one central repository at one time a day that we try to get that information out. But understand it's coming in all times of the day from both providers and the big labs.
Okay, thank you. Director Karsten?
Thank you.
Director Karsten, this question is from Brian Halsworth, Missouri Net, and he asked, the tornado shelter director in southern Missouri's Houston tells me that neither he nor the emergency management director there has received guidance on whether they can use the town's tornado shelter during the coronavirus outbreak. What advice would you give him and others who have the same concern?
Brian, that's a great question. I appreciate you asking it. I know it has to be on the minds of many Missourians as we face severe weather forecasts and certainly watch what has happened in our neighboring states. So number one priority during a severe weather warning is to take shelter and to be safe. And we ask that every Missourian have a plan to keep their family safe during those time periods. It is complicated with the coronavirus outbreak. And in the situation of tornado safe rooms, we would ask that you also have a plan in which you consider the social distancing, the no more than 10 people, and 6 feet apart. We understand that that may be difficult in certain situations, but again, it's encouraging for folks to look forward and to have plans for these circumstances that they might find themselves in. Thank you.
Okay, the final question, Director Karsten. This is from Jeff Bernthal, Nexstar. As the state continues to receive and distribute PPE, how are you prioritizing the order of who receives them first?
That's a very good question, and we've had others ask the same thing. And when the orders are fulfilled from the Strategic National Stockpile, we have criteria for hospitals, long-term care, and emergency medical services that we follow for that. And those entities are well aware of those requirements, and it has to do with the 14-day supply. For law enforcement and fire, we have yet to distribute a large supply of PPE, and we are working on that to prioritize it to the areas who are seeing the greatest impact of the coronavirus across the state and also have the greatest need. So thank you.
All right, I want to say again, thank you again to the Missourians doing what they've been asked and following social distance orders. We have been tracking data with MoDOT's travel map shows the traffic has been cut nearly in half. There are people out there doing the right thing, and we greatly appreciate that. Too many people keep saying the numbers are going up, so social distancing is not working. It is important to realize that what we're seeing today really happened 2 or 3 weeks ago. We have had a community transmission, so the numbers will continue to rise. This is not just going to go away in a few weeks. This is going to take a while. But the actions you take today will have an impact 2 or 3 weeks from now. We must continue to follow basic advice and reduce public contact as much as possible. Because at the end of the day, that is how we will stop the spread of COVID-19. God bless, and thank you very much.